Joining us now is Lewis Brown, CMF Curo Director, a Catholic healthcare option. Lewis will help us break down the Senate bill from a Catholic point of view. Welcome back to the program.
Thank you for having me.
Always great to have you here. Republicans have not come to a consensus on this bill to replace it. And as Catholics, what should we be looking for?
Sure, I would say there's two foundational issues from a moral standpoint, and then one that's kind of an issue of a preferential option. So the first thing is they have to make sure that they are defunding Planned Parenthood. It's absolutely essential, number one. Number two, and really I would say number one and A, one B would be that there's no public funding of abortion, and that concept, what's called the Hyde Amendment, is applied across the board throughout the bill. Lastly, it's very important that we encourage the senators to exercise what we call the preferential option for the poor, that we first look at legislation and see how does it affect the folks that are materially most impoverished. But what I see in this legislation, if they make sure that the Hyde Amendment is applied across the board and they defund Planned Parenthood, that could potentially be the biggest pro-life victory in U.S. history. And so what we're looking at is this vehicle that could be extraordinarily pro-life versus the potential of single payer. And that's the choice. It's not this bill versus some other bill in the future. It's really those two choices we have, and we have to do what we can as Catholics to support a pro-life bill.
Okay, but there are some Catholics and conservatives who believe that this bill and the USCCB, the Bishops' Conference as well, doesn't help the poor in a way that is in line with Catholic social teaching.
Yeah, and I would say there's a lot more work that needs to be done, especially when it comes to Medicaid, with regard to how we treat that population that's very much in need of care.
With pre-existing conditions.
Sure, but you also see that there's a lot of money appropriated in the Senate bill, billions of dollars appropriated from the Senate bill in successive years for high-risk insurance pools and for states to deal with that issue. What they're trying to do, they need to do a better job, but what they're trying to do is allow the states to have some investment and really more of an investment than it already has when it comes to that population, whether it be high risk or folks that are in Medicaid. And I think that's laudable, but it's not where it needs to be, and there's much more work to be done, and we need to be very loud on that issue.
Thank you so much, Lewis Brown, Director, CMF Curo.
Thank you.